everyone, my name is Julie, and I'll be covering intermittent fasting and its effect on certain health diseases and metabolic health. The development of several health ailments such as obesity, type 2 diabetes, and metabolic syndrome has become a prevalent issue in America. Obesity-related complications not only affect other metabolic variables in the body, such as blood pressure and insulin resistance, but they have become one of the main contributions to increased mortality rates. Thus, paying close attention to one's diet and implementing a healthy eating lifestyle is important to consider. The purpose of studying this eating style is that researchers have found intermittent fasting to promote metabolic benefits and weight loss. To analyze intermittent fasting and its health benefits, it is important to interpret the question, what is the efficacy of intermittent fasting on increased metabolic health and in decreasing health complications such as metabolic syndrome, obesity, and type 2 diabetes. Before probing into the impacts of intermittent fasting, the misconceptions of this eating practice should be addressed first. When looking at intermittent fasting from a general perspective, some people believe it to be an unhealthy practice due to the fact that it requires the restriction of food. However, researchers state that this outlook is skewed as intermittent fasting is defined as a voluntary eating pattern. In other words, it is a lifestyle choice in which individuals are still getting the nutrients they need, but in a specific time frame. Intermittent fasting is also commonly confused as dieting. Dieting involves cutting calories and restricting certain foods. However, the issue with this, according to researchers, is that dieting can easily develop into eating disorders without proper knowledge and professional guidance. Based on several research studies, improved metabolic function and weight loss were two primary effects observed from intermittent fasting. To interpret the data results on these two primary effects, a variety of fasting techniques, such as continuous energy restriction and 8-hour energy restriction, were utilized to assess whether there were any overlapping results that were significant. These studies focused on participants that had obesity, metabolic syndrome, and type 2 diabetes. The study by Gable observed the impact of an 8-hour restricting feeding program on body weight and metabolic disease risk factors in 23 obese adults. In the first 4 weeks of the fasting period, weight loss was notably identified in the participants, and systolic blood pressure levels were significantly lowered from the studies by De Oliveira and Gable. Similarly, in a study by Lee, an average weight decrease of 3.5 kilograms was recorded, which is 1.5 kilograms more than the control group with a 2.0 kilogram decrease. Lee also pinpoints that efficiency in decreasing abdominal circumference as well. Overall, the 8-hour intermittent fasting method tested in these 3 studies demonstrates how intermittent fasting can better metabolic conditions and help with weight management. According to research from Kundarasi and Osbeck, advising a 5 to 10% weight loss is recommended for older individuals with metabolic syndrome as it helps regulate blood pressure and blood glucose levels. Over a 12-week period, they analyzed 2 treatment groups, the continuous energy restriction group, also known as CER, and the intermittent energy restriction group, also known as IER. The participants were ages between 18 and 65, were required to have a BMI above 27, and had to be referred by a clinical dietitian. The CER group was the control group where participants engaged only in energy-restricted feeding, while the IER group fasted for 16 hours. The IER group showed a 6 kilogram drop in body fat, while the CER group recorded a 4 kilogram decrease in body fat over a period of 4 weeks. While both groups showcased reduced body fat concentrations, the intermittent energy restriction method was slightly more successful in lowering body fat. Both groups showed a large drop in blood pressure, lipid profiles, and glycemic measures as well. When juxtaposing this study with the studies that utilize the 8-hour fasting method, the Kundarasi and Osbeck experiment underlined similar results in terms of metabolic health and weight loss. Analyzing how this eating lifestyle affects weight and metabolic health in healthy individuals as well introduces a new perspective. In a study by McAllister, the researchers observed the effect of time-restricted feeding on cardiometabolic biomarkers and under isocaloric circumstances. 22 men completed a 28-day time-restricted feeding protocol, and fasting blood samples were analyzed for glucose, lipids, as well as adiponectin, human growth hormone, insulin, cortisol, C-reactive protein, superoxide, and more. Notable decreases in systolic and diastolic blood pressure, higher levels of HDL, and decreased body weight and body fat were recorded. By the means of dietary analysis, there was approximately a 22% decrease in fat mass in both groups. Overall, the study highlighted that intermittent fasting can provide health benefits to healthy individuals as well. There are still many gaps in intermittent fasting research that should be underlined. Small sample size and conducting the experiment for a longer period of time are a few limitations that should be controlled. In the study by Gable, for example, the researchers utilized a sample size of 23 obese participants, which is quite small. Increasing the sample size would help in yielding more accurate mean values, help identify any outliers, and lower the margin of error. Since there is more research to be done and gaps to fill in some of these studies, it cannot be confidently concluded that these outcomes are completely reliable. Thus, having an individual blindly rely on intermittent fasting for these specific benefits may not be the best course of action to take. As a result, consulting a health professional is critical. Registered dietitians can offer the most optimal advice and counseling to help treat conditions such as obesity. According to several research studies, intermittent fasting was emphasized as a promising solution to reduce risks of obesity, type 2 diabetes, metabolic syndrome, promote weight loss, and improve metabolic function. Although there are still some gaps and limitations to consider in these studies, such as sample size and the duration of the treatments, the studies reference other research to further validate their findings from overlapping results. It was found that even for individuals who do not have health complications, intermittent fasting can aid with weight management and improve metabolic health. However, because everyone's body requires different needs, consulting a dietitian would be recommended to ensure safe eating practices. And these are my references. Thank you for listening.